So the short answer to that question is no. A family member should never be interpreting for a patient. So this was posed in the medical setting. So let's talk about the medical setting for a moment. Um, Someone might be the most familiar with the patient, a family member, a son, a daughter, a parent, but and they may be extremely fluent in two languages, however, not trained as a professional interpreter. So let's just take the terminology as one piece. So, and knowing the medical terminology from one language to another is something that we're trained for in college, and it takes years of training. So, say I'm fluent in French and I can go to France and I can speak French and I can understand French, but I certainly don't know medical terminology in French. The next thing would be the inappropriateness as far as the relationship. It's extremely hard for a family member to be neutral, especially in an emergency or someone getting bad news. The feeling of wanting to protect that person, the family member, it's very easy to kind of screen information as it's coming from one way to another. It might be embarrassing or inappropriate based on gender. It could be actually a risk, a great risk to the medical practitioner, not to mention the patient, having inappropriate and kind of filtered out messages so that the medical care practitioner really doesn't have the information that they need to treat the patient. The patient might not want to be forthcoming about certain medical background or symptoms in front of their child or in front of a parent. So that's also another important issue. So that being trained, the neutrality that needs to happen with an interpreter on site, the inappropriateness in that setting, and also the harm that can happen to the person that's acting as the interpreter that's not a trained interpreter. And even if you are trained and you're a certified interpreter, you should never be in that setting with a family member or a friend because it can be harmful to the interpreter as well. First of all, in our profession, we have what's called errors and omissions insurance. That covers the interpreter and the person that's providing medical care in the situation that there might be something omitted or there might be an error in interpretation. That's not going to extend to someone who's doing something unprofessionally, which is providing interpreting services to a family member. And there's also the emotional harm that can happen to a family member when they're put in that situation. I've heard stories of children being taken out of school to go to medical appointments to interpret for parents, or someone that's in an emergency situation and it's very traumatic because your loved one is in that situation, but then you add on that layer of being responsible for interpreting. So in our field, no. Unless it's a dire emergency and can't get an interpreter there, up until that point, now we have virtual interpreting, we have telephonic, where we can get someone on the phone or virtually almost instantaneously. So there really isn't much of an excuse for doing that. And certainly it's putting the patient, the medical provider, and the person, the family member, all at great risk on different levels. If you have any more questions, feel free to ask on this platform or give us a call at Empire Interpreting Service. Thank you.